main reason why people are struggling with infertility is because we're living in an unnatural world. That's what we're battling with. We're dealing with ultra-processed foods, chronic stress, toxins, air pollution, all these things we don't even think about. But all of these things are having an effect on our body, having an effect on our health. I think, when you're looking at the conventional medicine approach to these things, they will just look at AMH. Maybe they'll look at TSH, one of your thyroid hormone markers. Whereas here at HUM2N, we've got so many tests we can run, we can actually find so much more data, actually get answers.
Welcome to HUM2N, Natasha. It's lovely to have you here today. So today we're going to delve a bit deeper into functional medicine and fertility. Before we start, do you want to tell us a little bit about yourself, if that's all right?
So I'm a registered nutritional therapist. I specialise in fertility, as you mentioned, and I use a functional medicine approach in the way I work. I am obsessed with everything health related and health optimization wise, and personally I love being out in nature. I love the overlap of science and nature and using that in my approach with my clients. And I live in Surrey with my partner and 2 cats, and yeah, that's me.
What's kind of driven your spark into pursuing kind of fertility as your special area of interest?
When I was studying nutrition, we spent maybe half a day learning about fertility. And I remember at the time thinking, this is really interesting and maybe something I'll come back to. But then I think since I graduated, it's kind of a specialism that found me. So when I graduated, I went straight into gut health. It was what I really knew a lot about. I had IBS for 10 years, so I knew just how debilitating IBS could be. It's not just having digestive issues, it affects your mental health, your skin, all areas of your life, your confidence. So I went into that, but then I found that more and more people were starting to come to me for fertility issues. And what I was seeing is that more and more people are struggling with fertility. And I was really surprised about that because my whole life I've tried not to get pregnant. But then actually when push comes to shove, it's harder than ever. So it really interested me. So I then decided to do an extra year's worth of training in fertility nutrition and then specialized in fertility. I just knew this is the one. And honestly, it's challenging, but there is just no greater joy when there's a baby there at the end of the day.
And you mentioned that we are seeing this rise in both primary and also secondary infertility, so women who've had a pregnancy but subsequently struggle to conceive. What do you think are the main drivers of, primary and secondary infertility now?
I think in general, just to speak generally for a second, I think the main reason why people are struggling with infertility is because we're living in an unnatural world. We're not living in the same world we were living in thousands of years ago, hundreds of years ago, even decades ago. That's what we're battling with. We're dealing with ultra-processed foods, chronic stress, toxins, all these things, air pollution, all these things we don't even think about, but all of these things are having an effect on our body. They're all these external stresses that are having an effect on our health. And I see fertility as being a good proxy of your overall health during your reproductive years. So really, for me, it's all about health optimization because that is going to be fertility optimization at the end of the day. So thinking about primary infertility to begin with, I think, when you're looking at the conventional medicine approach to these things, they will just look at AMH. Maybe they'll look at TSH, one of your thyroid hormone markers. But really, so many people are now diagnosed with unexplained infertility after just 1 year of trying to conceive, and then all they're offered is IVF. But actually, when we do that sort of functional fertility nutrition approach, we can run loads of tests. I think unexplained infertility is actually just unexplored, uninvestigated infertility. Whereas here at HUM2N, we've got so many tests we can run, we can actually find so much more data, actually get answers. And I think that's why it's so empowering, because previously people have been told there's nothing you can do to improve your egg quality, there's nothing you can do to improve your sperm quality, but actually we know that actually once you've got the data and you can see these underlying imbalances, then that's when you can actually start to make change and optimize your fertility. So some of the things we see really regularly in clinic will be things like hormonal imbalances, high toxic exposure, high stress levels, thyroid imbalances, mitochondrial dysfunction I think is really key and something not many people think about. And of course, poor diet, poor sleep, all these other things that seem to be having an effect. That's really, really common. And I think on the secondary infertility side of things, this is where you've already had one baby and then you're struggling to conceive for a second time. This is an interesting one, and I think it's because when you've got one baby or more babies, then your life's not actually the same as it was prior to that. Let's face it, you probably got worse sleep, more stress, probably a worse diet, maybe making fish fingers more than you used to. So you're not working from the same baseline. And also, let's not forget that things like pregnancy and breastfeeding are actually very sort of energy intensive processes. You're giving a lot of nutrients away. If you're not sort of replenishing your body after that, then your nutrient stores might be a little bit depleted as well.
Yeah, 100%. I think you mentioned quite a lot there. Let's maybe unpick a few of those drivers. You mentioned hormonal imbalances. So we do see a lot of that at HUM2N kind of in our general kind of clients coming to us for health optimization, functional medicine, and thyroid dysfunction as well. And in kind of the conventional practice, they do recognize that thyroid dysfunction is a common cause for infertility. And most fertility clinics are now offering thyroxine if the TSH is not optimal, because the optimal range for fertility and pregnancy is much lower than a conventional normal range. But from my kind of personal experience of having a thyroid problem myself and also treating lots of patients with thyroid disorders, is that it's just, there's so much more than just the TSH, right?
Absolutely.
We have to look at the full thyroid panel. We have to look at the T4 and the T3 markers, and how well is that T4 to T3 conversion happening as well, because 80% of the thyroid hormone that's produced by our thyroid gland is actually T4, but what our body and what our cells need is actually predominantly T3, and we need that effective T4 to T3 conversion to take place. So if you're just kind of lowering a TSH value, that might not necessarily improve fertility outcomes, because you need that optimal ratio of T4 to T3. And I think that's what, again, really fantastic, because as part of a fertility program or a health optimization program, we'll do a complete thyroid panel, look at all the hormone markers, look at all the other organs and test them properly on a blood test. So what are ways that women can maybe support optimize thyroid function and support hormones more naturally or holistically through functional nutrition?
Yeah, I think that's a really good point, firstly. And also we want to look at the thyroid antibodies, because they might have Hashimoto's, I might not know about it, or maybe even slightly subclinical Hashimoto's with raised antibodies. We want to be looking at that. And I think another reason why it's so important is because during the first trimester, the baby can't make any of its own thyroid hormone, so it's stealing the mother's hormones. So if you've got even a slightly sort of subclinical underactive thyroid, there's going to be an issue. And actually we see that as being quite a key cause of miscarriage in the first trimester, so very important. But in terms of supporting your thyroid health, so the thyroid's all about metabolism. So I think all these things we can do from a dietary perspective, lifestyle perspective to support our thyroid hormones, the better. So for example, from a diet, we are looking for a really broad diet. So not a restrictive diet. Eating the rainbow, eating really good quality sources of fats, proteins, carbohydrates. So just coming back down to the basics really, but then also thinking about some specific nutrients that are great for supporting the thyroid. So things like selenium, which you can find in Brazil nuts, just 3 Brazil nuts a day. That's a really easy one that anyone can take on today. And even iodine as well, so seaweed, seafood, that can be really wonderful. So you really want to be thinking, especially if you're on a vegan, vegetarian diet, how can you make sure you're still getting in some of these nutrients that are really supportive of thyroid health as well. And I also like to think about how the thyroid links to our stress hormones and also our reproductive hormones as well, because they're all influencing one another. And if you tend to see something a bit off on the thyroid side of things, you need to be looking at the adrenal side of things, the sex hormone side of things as well, because there'll normally be something off there. So, for example, stress management has to be a really key part of the protocol, which is the last thing anyone wants to hear, because everyone's already so stressed on a fertility journey. But also, on the sex hormone side of things, all sex hormones are made of cholesterol. So it's something we've been told to avoid for the past few decades. But actually, we need cholesterol. All our sex hormones come from that. So what's the fat content like in your diet? Have you got healthy fats in the diet? So we'll be taking a really holistic approach to really support the thyroid. And if there are any raised antibodies as well, we really need to be thinking about whether cutting out gluten for a period of time might be helpful to bring that down, or maybe any of the other sort of common allergens as well.
How long do you think it's optimal to work with someone to optimize health before even attempting kind of a fertility treatment or fertility journey? Because I know it differs from person to person, but I think ideally we want to be seeing these patients before they've even considered embarking on IVF, for example. What are your thoughts on that?
Yes, this is exactly how I want people to be thinking about it. I'd say 3 months. 3 months is the optimum amount of time. I mean, the longer you can do it, the better. So if you've been on a nice health optimization program for a few years, fantastic. If not, 3 months. Give us 3 months. And the reason for that is because it takes 3 months on average for egg and sperm to mature. So what you're doing right now, your current diet and lifestyle, your current state of health, is going to be affecting your egg and sperm quality in 3 months' time. So the best time to start was yesterday, the second best time to start is today. So that's how we kind of do the human programs as well. So we've got one shorter program, one longer program, but in general it's 3 months, really work on optimizing things, and hopefully everything's going to be back in the sort of optimal ranges then, and then you're, free to go.
Yeah, 100%. And I think it's really important to give your body time to heal as well, because say if you have got a chronic health condition, for example, there's a saying that it takes however long it took you to get ill to then get back to health or optimal health again. Absolutely. So, we should be encouraging time to allow for healing, for sure.
Yeah.
We touched upon men just slightly there. I mean, we're seeing a lot of kind of primary infertility in men now as well. There's so many factors affecting sperm quality, sperm DNA. What are you seeing as the kind of common drivers of male-led infertility?
Yeah, I think this is a really important part of the discussion, because actually we know that infertility is 50% male factor, 50% female factor. Yeah. But actually, female infertility is normally where the conversation sits, and that's not fair. And that's why we have couples programs at HUM2N, and we have programs just for men as well, if they want to do something like sperm freezing or something like that. It's very similar to women, actually, I'd say. So stress is a massive one for men as well. And if you think about stress, it's a survival response. The body's going to be mobilizing resources, mobilizing blood flow to the parts of the body that need it the most. For example, it's going to be going to your senses, it's going to be going to your brain, going to be going to your muscles to help you move, but it's going to be directed away from the digestive tract, the reproductive tract, because you don't need to make a baby when you're running away from danger. So stress for men absolutely is always going to be a key one. Again, diet I think is really important, so making sure that they're really optimizing the diet. Again, you see quite a lot of the burden on optimization on the women here, so the woman's trying everything. She has tried all the supplements, whether they're right or not, who knows, but really optimizing the diet, and sometimes the male partner could be a little bit more lax. And in a way, it's hard to blame them, because we've got less research on male fertility because it's always been seen as a female issue. So there's still a lot, we need to find out about that. But I think we can overlay the science with some common sense. We know things like alcohol's not going to be great. We know things like smoking, vaping, marijuana, not great either. So we really want to clean up the diet, clean up the toxins 100%. And I think one thing we're seeing more of these days is actually low testosterone as well. So that plays a pretty big role in things like erectile function, even sex drive, but also just generally the optimal functioning of reproduction. So we really need to be thinking about all of that. And again, we've got more tools at our disposal at HUM2N to really test male fertility. So if you go to the GP, if you go to an IVF clinic, they might do quite a simple semen analysis, but we want to go beyond that, because we know that you can have a normal semen analysis and a very off DNA fragmentation. And if you've got high sperm DNA fragmentation, then it's going to be affecting your fertility. It can even increase miscarriage rates and pregnancy success outcomes and all of that. So we really want to be looking at this very holistically.
And I think another unique test we've spoken about before is microbiome testing, so both vaginal and semen microbiome testing. Are you able to kind of elaborate or kind of talk about that a bit more?
So I think this is such a fascinating area of research at the moment, and it's worth saying that it's relatively novel in terms of an area of research versus the gut microbiome, but still the early results are alarming and incredibly useful. So we can run both of those tests. And we've got some amazing research findings already. So for example, 30% of infertile women have an imbalance in their vaginal microbiome. And there was a study done by Tommy's The Miscarriage Charity that found that in pregnancies which were chromosomally normal, the other women had an imbalance in their vaginal microbiome as well. So it's an important area to try and optimize for implantation rates, for IVF success outcomes. We've got all the research on this, for reducing miscarriage rates. But also, if you think about if you're having a natural birth and you're having a birth through the vaginal tract, the baby's going to be coated in the vaginal microbiome on the way out. So you really want to make sure it's looking good, because otherwise it could be affecting the baby's immune system. And there are even strains like Group B strep, for example, which we know can cause some pretty harmful have some pretty harmful effects on the baby. So if you can catch that early, then that's great. And we like to work preventatively, so let's do these tests up front, see what could be contributing towards your issues, or could be, if you're at the start of your journey, could be preventing you from getting the outcome you want, and try and optimize that first. And again, I'm glad you mentioned the semen microbiome, because let's face it, if someone's having sex, they're going to be swapping their intimate microbiome with the other partner. So if there is, for example, ureaplasma in the vaginal microbiome, we definitely need to test the man as well, because the likelihood is they're passing it between each other. If you get rid of hers, he's just going to give it back to her again. So yeah, we've got to look at both partners.
And are you finding that, working on the other kind of key microbiomes is important? So gut health, for sure, I know is a big, important kind of factor to improve for fertility. And the gut microbiome we all know about now. So do you want to tell me a bit more about kind of the gut health and the role of gut health in fertility?
Absolutely. I'm really passionate about this area, actually, because of my journey from going from IBS and gut health into fertility and looking at the link between the two. Let's talk about digestion first. So you could have the perfect diet, but if your digestion's off, then you're not going to be absorbing the nutrients from your diet. And what's the point? There's no point in having a good diet if you can't absorb those things. So that's why, at HUM2N, we always start with the gut healing protocol, just to make sure that your gut's working optimally. So you're actually going to be extracting all those nutrients from your diet and, reducing any chances of excess inflammation that could be happening if you've got like intestinal hyperpermeability or something like that. Optimizing digestion is really, really key. And if you think about how many people have suboptimal digestion because of stress levels as well, as I mentioned, blood flow, resources directed away from the digestive tract, digestive enzymes and digestive juices, their secretion is going to be depleted because of stress. So really optimizing digestion first. And then the gut microbiome, I think, is a really interesting area as well. So if we've got any signs that there could be an imbalance in the gut microbiome, definitely a good place to test as well, because we know that the gut microbiome has such a vast impact on our health. So it regulates things like our hormone levels. It plays a massive role in our estrogen metabolism. Also things like our immune system, 70% of our immune cells are in our gut, and the influence it has on our mental health, things like that. So it has to be a key area of intervention. And I like to see the gut microbiome as being kind of like the control center of our other microbiomes, because you've got these microbes everywhere, but the gut microbiome contains the vast majority of them, because it's the perfect conditions for microbes to thrive. So if you work in the gut microbiome, the likelihood is you're going to see a beneficial impact in the vaginal microbiome, the seminal microbiome, and all of that. And just to touch on one more microbiome for now, I think the research around the oral microbiome is really interesting at the moment, because if you think about it, what's going on up here is going to be affecting what's going on further down here. So sometimes I think when we get some really unusual gut symptoms that are really hard to shift, actually need to go further up the digestive tract and think what's going on in here. Do they have oral thrush? Do they have gum disease? Do they have bad breath? We really need to optimize further up the digestive tract too.
Yeah, it's fantastic how even kind of oral health ties into fertility. Like you would kind of make that connection normally.
Totally.
I think another thing that I'm seeing a lot of in practice is mitochondrial dysfunction and mitochondrial disturbance. So we know that the mitochondria are our energy centers of our cells, vital for producing ATP or energy, and the ovarian tissue and kind of all the male reproductive organs as well, kind of enriched in mitochondria. And if we're starting to see mitochondrial dysfunction, that's really going to affect our egg and sperm quality. So are you able to tell me a little bit more about the kind of mitochondrial function when it comes to fertility and ways that we can perhaps kind of improve our mitochondria?
Yes. Another area I'm really passionate about. I think I'm passionate about all these areas, actually. This is interesting because lots of people actually don't know what the mitochondria is, but we know it plays a really significant role in our health and fertility. And to give an example of that, the egg, which is a cell itself, contains 10 times more mitochondria than any other cell in the body. So that just gives you an idea about how important mitochondrial health is for fertility and just how much cellular energy is needed for fertility. So if you think about how much energy you need to mature an egg, to release the egg, to push the egg out of the ovary, to help the sperm swim towards the egg, to help them both fuse, to then multiply into different cells, and then build a baby. I mean, you need so much cellular energy for that. And that all comes from the mitochondria. And I think one of the interesting things here is that we know as we get older, unless you do something about it, your mitochondrial function does decrease with age. And at the same time, people are delaying when they're having babies. By the age of 40, about a third of the mitochondria aren't working as well in the human egg. So this is why we really need to support mitochondrial function. And I think the other interesting side about mitochondria is the mitochondrial DNA. So the mitochondria have their own set of DNA, and the baby inherits all of the mitochondrial DNA from the mother. So unlike other DNA, where you get 50% from the mother, 50% from the father, the mitochondrial DNA all comes from the mother. So it's even more important that the mother has that fantastic mitochondrial function. But it's also important for the man because mitochondria help the sperm swim. So they're in that middle centerpiece and they just help the sperm swim as well. So if you see suboptimal sperm motility on your test results, for example, then you definitely know you need to be working on mitochondrial function.
I think that's what's great about our therapies at HUM2N. So we've got the IV NAD+, which is fantastic for providing, a key component for mitochondrial energy production. And now we've even got the NAD Home Kit. So for clients who may wish to work with us remotely, we can send out NAD Home Kits as well for them to use, which is going to naturally help boost mitochondrial function.
And the red light therapy device downstairs.
Yeah.
And even the hyperbaric oxygen chamber, I think, can be really helpful for mitochondria.
Yeah, so hyperbaric oxygen chamber therapy is fantastic for fertility generally. And we have got a fertility optimization package where clients who want to have the therapies for fertility optimization can come in to have the IV NAD and have the hyperbaric straight after, because we find that that combination works so well together. If you had the NAD first and go into the hyperbaric chamber, you're essentially helping all of that NAD that's in your blood vessels kind of get flooded into the cells through that hyperoxygenation. It's really fantastic.
It's a really great way we can support people's fertility before they even start trying to conceive, but also leading up to IVF or even egg freezing or sperm freezing or something like that.
And actually that kind of brings me on nicely to the next topic, which was going to be around the egg collection, egg freezing, because we know that, that in itself can be a very stressful process for women to go through. You're obviously having kind of exogenous medications, hormones to help improve egg maturity. So again, something that would be really kind of key to work with us at HUM2N on is that detoxification post having an egg collection or egg freezing therapy, because we know that certain exogenous hormones can further trigger hormonal imbalances, and also kind of if we're not detoxing effectively can lead to other health issues. And again, because we are just kind of surrounded by toxins, it's going to affect our natural detox capabilities of hormones. So that kind of detox element around egg collection I think is really, really important. Do you find that kind of any specific detox strategies work effectively when it comes to that egg collection, egg freezing phase?
Yeah, I think it's a really good thing to focus on, because I think most people think do your egg collection and then you're done. But no. So I think we need to think about all the drugs, the hormones being pumping into your body, and just help you get back to that sort of state of natural balance and homeostasis. Lots of people think of the liver as being the detox organ, but actually we know that it's just one part of it, and the liver is really important. We want to be supporting phase 1, phase 2, phase 3 detoxification, and there are different supplements and different dietary strategies you can use to support each of those. So we want to be supporting the liver, but we also want to be thinking about the other ways we detoxify. So for example, we detoxify loads through our sweat. So getting a sweat on, exercising, going to a sauna, infrared sauna, can be really beneficial. Also, we want to be moving regularly to support our lymph, which is another really important part of the detox pathways. So not just exercise 3 times a week. That's not really how you were designed to move. We were designed to be much more mobile than that. So regular movement on top of your exercise. And then also we want to be going back to the gut, as always, again. So our bowel movements are another way we detoxify. So we get things out of the body. So are you regular? And women do lean on the constipation side of things for various reasons. So we want to be making sure you're definitely having that daily bowel movement. So all of the usual gut healing stuff we do and supporting gut motility, I think, is really helpful.
Can you describe a kind of an average patient's journey if they were to come and work with us at HUM2N?
Yeah, of course. They would have an initial consultation with us. Prior to that, we would send a very detailed questionnaire. So we get a really comprehensive picture about their health history to date, but also their current state of health and their fertility journey to date, any medications, any supplements they're on. So we'll talk about that more in the initial consultation, and then we'll recommend potentially some dietary changes, lifestyle changes, supplement changes, or supplement additions, and also any testing recommendations too. And as we've already alluded to, the more data we have, the better. And we are capable of giving people a lot of testing, much more comprehensive testing than you'd get at the GP or at an IVF doctor, for example. So we'll discuss all of that. And then if you're happy to, you go away and do some of those tests that we've suggested. Then we'll have an interpretation consultation where someone like you will join the call and help go through the test results, make sense of them, talk about these patterns we're seeing, and we'll continue just to build on the plan. So that's kind of how it works. Then we'll have more follow-up consultations after that, and we'll continue to see what's working, what's not working, iterate the plan, retest. We've got separate programs for men and women. But in an ideal world, I'd say we're going to be working with the couple because 2 people make a baby. And so if you are in a partnership, and you're both hoping to try and conceive, then we want to be seeing 2 people in the partnership for sure.
I think you kind of really hit the nail on the head there. We really need to be seeing both partners in when it comes to fertility, conception, and then even carrying on with the healthy pregnancy. That's really, really important. And then in terms of the egg collection, having those therapies, ideally kind of 2 to 3 weeks beforehand will really help improve the egg collection process, and then post-egg collection, working with us to help detoxify some of those excess hormones that may be in the system.
Yeah.
It's been fantastic speaking to you today all about fertility, and I'm really excited to have you on the team to do our fertility programs, and yeah, let's make some humans.